The Harvard Street Neighborhood Health Center will soon mark its 50th anniversary. To tell us about the center's history, its importance to the community, and plans for the future is the president and CEO, Stan McLaren. Thank you very much for being with us, Stan.
Thank you for having me.
And happy anniversary.
Oh, thank you. Thank you very much.
I want to go back to the beginning here because when people see these health centers, we take them for granted. We think, well, that's just doctors and nurses and clerical staff. So what really got this all started?
Well, community health centers comes out of the civil rights movement, and the first two health centers was actually in Mississippi and Boston. And this is all about gaining access to care for folk that are in urban communities and also, believe it or not, rural communities. And community health centers was a way to make that access occur. And Harvard Street was one of the early players when it came to that. We actually got our doors open in 1969, which is around the time when things were really active. The community health centers, I believe, played an extremely important role in getting care and access and giving access to an underserved population and people that are either at or below the poverty level that really need care. So we're in the forefront.
Yeah, I mean, this is a case book in, I guess, disparities, just the people you serve, right?
Absolutely. We're on the front line. We're right there where they live. We make it real convenient to be able to come and get care. We got folks that are dealing with paying rent or trying to decide between paying rent and making sure they have enough food. And in this case, in current cases, ability to even be able to afford medication and everything. So we're kind of right there. So you're not always deciding between, do I have to take a time off work and make it to an appointment, or you're not waiting till it's too late. We're there making sure that we're in the community, we're letting them know we're here, we're having different outreach campaigns, we're making sure that our providers are available, and in our center and in some others, that we provide comprehensive care. When you walk through our doors, we're taking care we can take care of all of it. We have eye care service, we have dental care. So when you walk in, when you're missing that day of work or even when you come in on the weekends, because we're open on Saturdays, we can take care of you.
You also focus on things that are especially important to the neighborhood, but maybe not universally the same, like trauma. Tell us about what you do for that.
So we were recently named by the mayor to be part of a Grove Hall trauma team. As you know, there's been a lot of recent spurts of gun violence, and the team that we have, we're partnering with the Boston Public Health Commission, also Project Right, along with our behavioral health staff. We deal with the after effects of that violence. There's an aftermath, there's a residue, there's a collateral damage that occurs. And we come in on the back end of that to deal with that collateral damage and help our community kind of fight through the issues. Heck, on the street we were in, when I drive to work, I see a kind of police detail because a young man got killed just like a few blocks away from us. So we come in and help families deal with that. I think this is a creative way in which we're involved, we're actually very happy to have gotten the funding to be able to participate in the program.
I imagine trauma is also something that it's not just somebody who gets shot or who's within close range, but it could be somebody coming out of incarceration, or it could be family dealing with that same problem.
It's a whole host of issues. What we've done also, there's been a lot of stigma, especially in my community, I say, because I live like 5 minutes from the health center. There's a lot of stigma associated with mental health services. And so what we've tried to do is make it like seamless, so kind of a warm handoff. So if you come in to get primary care services, if we are screening and see that there are issues that you may need to deal with that are behavioral health, we've integrated our behavioral health services with primary care. So folks can, while they're there and make it convenient, the service is made available one time. But you have a lot of people that have probably a normalized and abnormal way of being, and they're presenting in different ways, and we try to see how best we can identify to be able to provide mental health services and make sure that there's not this stigma attached to it.
And you have services dealing with addiction problems too?
Yes, we actually recently received some funding. We went after quite a bit of funding to expand our care with regards to substance use, and as you know, with the recent opioid epidemic and everything. So yeah, our behavioral health counselors are there to help folks with their addiction and everything else. So we've been able to expand those services in the community, and we hope to even expand a little further.
Tell us about the expansion, because we're talking about a new structure here, right?
So we were designated land from the city of Boston, and I'm happy to say the board and the board has given me permission to go after a very impactful vision for that area. We're one of the bigger employers in that area. And what we are trying to do is make sure that we have a state-of-the-art facility to not only continue to provide the care that we already provide, but also make sure we're all under one roof. Currently, we're in a building that's a bit obsolete, and as you can imagine, it's our 50th year, and we need to upgrade. But what we did that I feel is unique is we had some shared visioning meetings with the community, where we were able to get ideas from the community, and those ideas are being incorporated into the new building that the new facility we're trying to put up. So that it includes some holistic care type things, some health and wellness. For example, activities like yoga, or making sure that we have community room, space for the community to come in that if they need to meet, demonstration kitchen, stuff like that. So those are the things that the community was telling us that they need. But what's awesome about what we're trying to do, I believe, or what's impactful about what we're trying to do, is the building that we're currently in. We want to not only have additional build-out space for the health center. We want to make sure that there's commercial property, businesses that can come in, and we want to also provide about 40 units of housing. So we'd have this campus approach. The designated spot that we have, we'll build a new health center, have dynamic services in there. In the new building, in our current building, we'll redevelop it into a mixed-use building. On the first couple of floors, have commercial, additional build-out space, retail space, and then on top, 40 units of housing. We'll be dealing with the housing issue. We'll be dealing with jobs for the area, and also increasing access to care. So this is not just about increasing access to care, but it's about economic development and the potential to revitalize an area that really needs to be revitalized.
And finally, please tell us about what's happening on October 4th, your anniversary event.
Yes. We're celebrating our 50th year of service to the community. We want everyone to come out. We actually got quite a bit of sponsors that, I want to make sure that everyone go to our website. You'll be able to see who's sponsoring us. But at the same time, this is just an opportunity to really just celebrate, for us to be able to mention our accomplishments to the community. And before I say I need to give our phone number, just in case any of you out there would like to come and help us out and sponsor the event. We are at, our phone number is 617-822-5594. We set up this line specific so we can receive calls and get some generous sponsors. This will allow us to continue to provide the services. And you need to know that our providers are some of the best trained providers in the country. They come from some of the best schools in the country. So I'm excited. I hope that folk come out, and I know we'll have a great time. It's gonna be held on October 4th. It's going to be on a Friday, October 4th. It's going to be held at the Exchange by the Seaport.
Thank you very much for being with us.
Thank you. Thank you for having me.
And happy anniversary, Stan McLaren.
Thank you.
From the Harvard Street Neighborhood Health Center.
Thank you so much.